Hi, I'm Dr. Donald DeFabio and welcome to the Pain Summit, Natural Solutions for Pain Management. The usual disclaimer, this is my information. Just because you're watching this video doesn't mean you and I have a doctor-patient relationship. Before you do anything in this video, discuss it with your healthcare provider. If that happens to be me, you still have to talk to me about it, all right? Hey, what's the bottom line? The 1 minute, 2 minute synopsis is we're going to talk about the opioid crisis and how we created it ourselves because we're treating pain and not the problem. This video is going to teach you how to address the problem to get rid of your pain. We're going to talk about nutrition and foods for pain. The bottom line here is anti-inflammatory diet. We know, based on human biochemistry, that you can use diet to reduce inflammation and pain. How? And omega-3 fatty acids are found in vegetation and in foods that eat vegetation. They reduce inflammation. Omega-6 fatty acids are found in grains, fried foods, and they drive inflammation. So if you have a diet high in omega-6 fatty acids, like a grain-based American diet with lots of fried foods, you will be pro-inflamed. If you have a diet that's high in vegetation and in grass-fed beef and in organic raised meats and in fish, because they eat plankton, which is basically a vegetation, it's high in omega-3 fatty acids, you will be less inflamed. You also need to stay away from white flour and white sugar because they drive inflammation as well. There you go, based on human biochemistry. Exercise and pain. You have to do cardiovascular exercise, you have to do strengthening exercise, and you have to do flexibility exercises. The key is if you have arthritic pain, you need to exercise enough to maintain movement and strength, and not too much that it accelerates the inflammatory cascade. But that's what your supplements and lifestyle are all about. And that's the next thing we're going to talk about. What are the supplements I like? Well, here's the list. Omega-3 fatty acids, Boswelia, rosemary, turmeric, curcumin, systemic enzymes, CBD, glucosamine, chondrotin, and white willow bark. Those are my favorite. We're going to go over why in a moment. And ultimately, make some lifestyle choices for natural pain relief. You're watching this video and you want to take charge of your health, so we're going to give you that information. So there's the bottom line. If you want the rationale for all of these, that's what the next 12 minutes are all about. So now we're going to talk a little bit about why. Opioid crisis, where did it come from? Well, opioids are a class of drug. They're synthetic forms of morphine and codeine, right? Oxycontin, Percocet, Vicodin, fentanyl, Naxalone, hydrocodone, methadone, and they're great. They all work really, really well for pain control. That's the problem. When you're treating pain as a vital sign, you want to really go after it, so you give them heavy-duty stuff. This is like going elephant hunting. I'm using an elephant gun for going, squirrel hunting. It works great, but there's not much left of the squirrel. And what happens? You can end up with 76% of drug overdose deaths worldwide are from pharmaceutically produced opioids. And you know what's really sad is that 80% of heroin addicts report their entry-level drug was oxycodone or hydrocodone. That was their entry-level drug. Boy, that's sad, okay? And this is a really cool study from JAMA. In 2018, the Journal of the American Medical Association. I'm going to read it to you. Patients dealing with chronic back pain or osteoarthritic pain in the hip and knee did not experience better pain-related function than those taking non-opioid medications, which are far safer. Because we know opioids are an entry-level drug to heroin, and we know that it leads to a lot of overdose deaths. What about the American College of Physicians? This is really cool. They're saying for subacute or acute lower back pain that's only been around a few weeks or just started, your treatments of choice, superficial heat, massage, acupuncture, and chiropractic spinal manipulation. The American College of Physicians. How about that? 2017. Research now. This isn't just my idea. These little white things on the bottom are where I get the information from. So what are the options? We talked about an anti-inflammatory diet based on human biochemistry. You have to eat anyway. Eat green leafy vegetables, eat fruits, drink lots of water, drink green tea. If you want to have one drink a day, you can have stout beer or red wine. They're high in antioxidants. Olive oil is good. Coconut oil is good. Stay away from the fried foods. Stay away from the corn oil, the soybean oil, and stay away from the white sugar, white flour, and white potatoes. All right? Options: massage, chiropractic, acupuncture. Great stuff. Loosens up the muscle knots, restores range of motion, restores homeostasis, balance in the body. Chiropractic balances the nervous system so you sleep better. You have better range of motion, you have better posture. When you have better posture, there's less wear and tear in your joints, which means less arthritic change. And of course, exercise. Cardiovascular exercise to circulate your blood so your nutrients can go all over. Strengthening exercise to stabilize your joints so you can maintain your activities of daily living and stay functional. And flexibility so you have the range of motion to do things. And it's really important to hit them all. And how much of what you need depends on your body type and what your doctor tells you. But exercise is essential. And it could be, if you have chronic pain, something as simple as Tai Chi or yoga, or a brisk walk for your lower back. Great research on that. Hey, what about other drugs? Maybe we can just use other drugs, like gabapentin, Neurontin, right? Well, guess what? According to this study, using gabapentin and other anticonvulsant drugs have not been shown to be effective for the treatment of low back pain with sciatica, radiculopathy, and are associated with an increased risk of adverse events, problems. So let's go to things that are safe. And that's where natural pain-free living comes in, because the power that made the body can heal the body. And that's really important, and that's what we want to talk about. Let's go after the cause of the pain, get the body to heal. And that means you got to give the body the help it needs. And you also have to give it the time it takes. And you also have to give it the attention it deserves. It's going to take a little effort. But you're watching this video, so I know you can do it. Pain and inflammation go hand in hand. All right? If you have acute inflammation, it swells up, you sprained your ankle, well, that's hot, red, swollen. That inflammation, we only want it to last 3 to 5 days. That's where I use my systemic enzymes, and we'll talk about that in a moment. Chronic inflammation is what creates so many diseases. 70% of all mortality cases are related to chronic low-grade inflammation. That's what you can control with diet and lifestyle. And that makes a difference not just tomorrow, but 20 years from tomorrow. I wouldn't be alive today if I wasn't on an anti-inflammatory diet, because it reduces my genetic expression for disease. And that's how it works. What are the safe supplements for pain? We talked about omega-3 fatty acids. What do you need to know? They need to be purified. They need to be kept fresh. Don't let them get rancid, no fishy odor, because then it's just rancid oil, all right? I like blister-packed ones, and I like ones that are concentrated so I don't have to take a lot, because you need at least 2,000 to 3,000 milligrams of EPA and DHA a day to create an anti-inflammatory effect. Boswelia, it's a great herb. I love it. I use it all the time. And also down here, curcumin, extracted turmeric, another great herb. Use it all the time. Turmeric I go to a lot with sciatica and disc syndromes, but you got to take the right dose. That's what's important. Systemic enzymes, I mentioned that for acute swelling. That's extracts of pineapple and papaya from vegetarian sources. They come from animal sources, trypsin, chymotrypsin as well, but it works really, really well for swelling, acute swelling. You can take it for chronic inflammation, but in my office, I like to use it for acute swelling. But all of those things, those are COX-2 inhibitors, just like Advil. Works the same way in your body, but they're natural. You have to take enough, and sometimes it takes a little time to get into your system. Glucosamine and chondrotin, I find that works really well for the larger joints, personally, knees and hips, all right? But that's where exercise comes in, and we'll talk about that in a second. CBD. CBD can be taken internally, and I start low and build up. If we see a change in 2 to 4 weeks with our dosing guide, then we know it's going to work for you. If we don't see a change in 2 to 4 weeks, well, it's not going to work for you. Topical CBD comes 2 different ways. It comes with menthol and camphor and other irritants to give it an icy hot feel, and it comes plain. If you're using it with menthol and camphor, well, in my opinion, just go buy some BioFreeze because it's probably going to feel the same. If you want to get CBD and find out if the CBD topical is working, get one that has no menthol, no camphor, no counter irritants, and then you'll find out if the CBD itself is really working. You also have to get one that has a transfer agent in it that'll penetrate it through the skin so it just doesn't sit on the skin. So be an informed consumer with your CBD. White willow bark on the bottom here, why did I put that there? That's old school. That's aspirin. That's where aspirin comes from in its original source. Hey, if you're sensitive to aspirin, don't take white willow bark. But if you aren't sensitive to it, hey, that might be a good choice. By the way, systemic enzymes, if you have a history of gastritis, or they're usually extracts of pineapple and papaya. If you're allergic to them, don't take them. They must be enteric coated, by the way, on an empty stomach. All right? In the description box of the video, I talk about where I get all these if you want to see my sources. Exercise to stop the pain. We talked about you need cardio and strengthening, but we didn't hit this and why it's so important. Weight loss. Pro-inflammatory chemicals get stored in fat, and then it just creates that vicious cycle. So if you're on a standard American grain-based diet, grains and fried foods and white flour and white sugar and sodas, guess what? Those chemicals then get stored in fat and it creates a vicious cycle. So you got to lose the extra weight, and it's going to help your weight-bearing joints, hips, knees, ankles, and feet. Musculoskeletal pain, I treat it all day long. It's the #1 cost in America today. It's this, tech neck, right? From here, my head weighs 10 pounds and I have to hold up 10 pounds. If I'm slumped 60 degrees off midline, my head now weighs almost 60 pounds. Same thing with your lower back if you're curved. Same thing with your knee if it's out of alignment, right? Let's fix your alignment. Then let's give you corrective exercises so you can maintain tall, strong posture with your everyday life. And it reduces wear and tear, and the muscles don't have to work so hard. You have less pain. Then you add in some nutraceuticals. Then you add in proper anti-inflammatory diet, and you have lifestyle changes. So I've said a lot, but what does the medical community say about the treatment for acute, sudden onset, and chronic, meaning low back pain that's been around more than 3 weeks? Well, according to the American College of Physicians, according to the British Medical Journal, according to a think tank out of England, out of the Lancet Medical Journal, which is like the JAMA of the UK. What about the American Pain Society? What about the Journal of the American Medical Association? We already mentioned them. The Joint Commission, the FDA, the CDC. All of those groups, all of those medical reference think tanks say your first line of treatment for acute and chronic low back pain right here, spinal manipulation, chiropractic adjustments, exercise, rehabilitation, massage, tai chi, yoga, acupuncture. Wait a minute. I don't see drugs here at all. No. First line treatment for acute and chronic low back pain, you're looking at it. Chiropractic care, exercise, rehab. That's what you need to do. Now, if that doesn't work, you got choices. We go to second line treatment. Advil, Tylenol, over-the-counter medications. But guess what? Those are COX-2 inhibitors. Those are LOX inhibitors. Well, what's omega-3 fatty acid and ginger and turmeric and curcumin and systemic enzymes? They're the same thing. They work the same way. They're gentler. They're a little slower to get into your system, but you got to get the right dose and they work. But there's a third line choice. You got choices. Now we're talking opioids. Now we're talking prescription drugs. So if conservative non-drug care doesn't help in 2 to 4 weeks, then you'd go to over-the-counter drugs. 2 to 4 weeks. If that doesn't work, now we're looking down here, prescription drugs, and if that doesn't work, yes, we may have to consider surgery, we may have to consider injections. That's what the current research says is evidence-informed decision-making for low back pain. So you can decide to treat your low back pain one of two ways, by going after the cause and treating the problem and with the current evidence, or you can just do what everybody else does and throw drugs at it, which is not shown in the current evidence to be effective or safe. So we have to stop treating the pain. We have to start treating the cause. Let's restore homeostasis. It's all about health care versus sick care, which is what chiropractic does all day long. It's about prevention and treating it, and it's restoring balance in your body. And healthy lifestyle choices are laughing, getting enough sleep, diet, nutraceuticals, exercise, and take those chiropractic adjustments to balance your body and nervous system, improve your posture, and encourage a healthy lifestyle of treating the underlying cause of dis-ease, not just the symptom. I want to thank you for tuning in today. It was a lot of information. And remember, just give your body the time it takes, the attention it needs, and the help to get to where you want to be. I'm Dr. Donald DeFabio. Thanks for tuning in. Like and subscribe me. I'd really appreciate it. Have a great day.